Hello, everyone. Welcome to Bringing Virtual Care Home. My name's Tina Null, and I'll be your host today. I also am the Chief Clinical Officer at Anelto, and my guest today is Dr. Keith Fernandez, who is the Chief Clinical Officer at Privia Health. Today, Dr. Fernandez and I are going to be speaking about physician enablement and how it's changing healthcare. Welcome, Dr. Fernandez.
Thank you. I'm glad to be here.
Well, I'm glad to have you. And I thought we could start today by you giving the audience a little bit of your background.
Sure. I am the Chief Clinical Officer of Privia. I actually have several roles in Privia. I'm also the Chief Medical Officer of one of our markets and one of our accountable care organizations. So I have kind of multiple roles. Been with Privia almost 7 years. And prior to that, I was the Physician in Chief and CMO of the Memorial Hermann Physician Network and ACO in Houston, Texas.
Okay, well, thank you for that. It's not uncommon in healthcare today for anyone to be wearing multiple hats, but those sound like big jobs, so good for you. Can you give the audience an overview of Privia Health?
Yeah, sure. I'd be happy to. Privia is a company that really partners with physicians in multiple markets and multiple different kinds of models. We partner with physician groups, of course. We have partnerships with payers, partnerships also with hospital systems, like the Ohio Health System that you just mentioned. But our job there is to bring certain types of enhancements to physician practices. In common terminology, it's called physician enablement, and bringing physicians who need help with technology, a very robust, for instance, technology platform at the base of which is Athena, but has a Privia overlay on that to make it much more effective for all of the value-based care that has to be done nowadays. It's also effective for just managing patients, by the way. We bring other types of services that, especially small practices, and by small I mean even 100 doctor, 200 doctor practices really can't have easy access to, like, just fantastic contracting expertise, data analytics, the technology platform, which provides a lot of information to the physician about a patient right at the point of care. So not just, information lists that come to you, but when you're actually seeing a patient, what does that patient need to have? What would benefit the patient? Powered by tools like clinical decision support, that drives certain types of activity based on the patient's health status, that sort of thing. We also bring services that I think are just fantastic for doctors. You hear a lot about burnout, and physicians, coming to work, and it's like just a job to interact with the electronic medical record. It's many hours after work. A lot of attention diversion, even during a patient visit, that can make it very disturbing. And we bring resources that actually take a lot of that burden off of the physician, that I think really improves their ability to practice medicine the way they want to. Physicians really want to stay in a relationship with a patient. Clinicians, the same way. They want to see a patient and interact with that patient one-to-one. They want to have autonomy, and autonomy doesn't mean that they're doing whatever they want, so to speak, but it actually means that they have the ability to engage a patient differently and have a relationship that allows them to do what that patient wants to do, along with what probably is necessary to do. Maybe the most important thing in alleviating burnout is protecting the physician and patient relationship, which is one of our primary goals. So I think that's in summary what it is. I think of it, when a physician joins Privia, they want to join for some of those benefits, but always they want to do the same thing. They want to provide great care for patients. So it's not as though they want this, for just the convenience, but to enhance the great care that they can provide. So we think of this as really enablement, as providing great care for physicians in their practices, right? Really taking care of them. And that allows them to focus on the patient primarily. The other thing is, value-based care is very different than the older style fee-for-service medicine. Fee-for-service medicine still dominates, the world. But value-based care is much more focused on a patient outcome. And so it's not just what's happening at that visit that counts. It's not just what's going on today, how do you feel, what can I do about it? It's who are you? Where do you live? What kind of barriers to healthcare do you have, which can be provided to that physician in the practice at the point of care, which can change the way they interact in a much more beneficial way. They can actually address the real needs of a patient other than just the complaint. And that sort of thing, I think, improves outcome. I'll give you another example of, I think, really providing great care for patients. We focus a lot on access. That's our most important kind of activity. How do we give patients access? And we want to do that wherever they are, however they want to receive it. We have a very robust 24/7 virtual clinic that any of our patients can access anytime. The people who manage that clinic are Privia people, Privia physicians, so that it's actually in the electronic medical record. Your doctor's notes are visible to that group, and you immediately get informed about anything that happens in that clinic. Closely associated with that is a nurse care, we call it the care advice line. It's multi-purpose a group of nurse care managers who manage things like transitions, questions. I need this, I need that, I feel bad, what do I do? They're connected to that virtual clinic as well. So if the patient seems like they need something more, it can go to the virtual clinic. And the clinics can schedule patients for tests, do schedule and order laboratory tests, those sorts of things. I think we're exploring moving into what I think is, instead of an office-based centricity, really a patient-based center. So we want to take care of that patient wherever and however they want to be taken care of. And that's difficult, but I actually think it's going to improve outcomes. Having the ability to get care whenever you need it with your provider, with your doctor or nurse practitioner or clinician, I think is critical to reducing hospitalizations and emergency room visits and care by people who really don't know the patient the same way that their primary physician knows the patient. We want to use tools like, the virtual clinic. There are many tools in the virtual clinic nowadays that we didn't have 15, 20 years ago, at least not the same way. For instance, remote monitoring. And I think I heard a different term for it, but ambient monitoring. Remote monitoring is kind of focused on, I want to do your blood pressure. Ambient monitoring is actually having the tools in the home that will help engage that patient, keep them safe, allow them to interact with their care provider in any fashion that they want to. So I think the other angle that I think is important is, in value-based care, sometimes a patient doesn't know when they need something. They forget. They don't want to go to the doctor. They can't afford to go to the doctor. They don't have transportation to the doctor. It's 40 miles, outside of Washington, D.C., and the only appointments are when there's a lot of traffic, all of those kinds of things. We want to be able to ensure that those patients can be taken care of. And so we're right now exploring home visits, different level home visits, from neighbors to EMTs to nurse practitioners. Occasionally, some of our physicians still do home visits. We have whole practices that do that primarily, and we want to be able to reach those patients when they have no idea that they need to be. We know they're sick. We know they need to get something. We want to be sure they get it, and so we can reach out. So I think it's kind of giving your provider access to you, even when you may not be able to go see them in some fashion.
Wow. Well, that is wonderful. I hadn't heard that term ambient monitoring, but my company does have a comprehensive remote patient monitoring solution, and I would like to believe that some of our tools in the home do provide that as well. And the insight that is gained when you're looking at a patient in their home environment helps you deliver care in a way more effective way. Some might call it smarter care because nothing is artificial about that environment compared to when the patients come into the office. And then to take your solution further and make the office more meaningful with the tools that you talk about, Privia providing physician practices, just creates a whole new enhanced world in healthcare. So great for you. Can you talk about some of those key components to physician enablement that Privia provides?
Yeah, sure. I think that first of all, there's a ton of information in the world about patients, and of course, the future is going to be even more information. With all of the different areas where you can gather information that may help you understand how to treat a patient. But for a physician in a practice, how do they get that information? How do they make it usable information and actionable information? Because getting big lists, tons of information in different places or in the wrong place, like it goes into the EMR, but it's not where it's supposed to be, all of those kinds of things. So our technology allows us to filter a lot of that, to do a lot of the work in the background. I mentioned earlier clinical decision support. And basically, it's just a phenomenal tool. It's not perfect. None of these things are, but it searches the record for certain information. For instance, if you have a history of diabetes, it searches, did you get the appropriate diabetic testing? It searches the record perhaps for medicines that are high risk in diabetic patients. It also can interact right at the point of care if a physician orders a drug that really probably should be avoided, if possible, should be avoided in a diabetic patient. And it says, hey, maybe do you want to think about this for just a second? And actually, it's not too, I think when I tell physicians that, they sometimes go, I don't want any more, pop-ups or anything like that. Well, these are not intrusive. They just say, hey, if you want to, you can change that. Or you want to consider this. You can also ignore it, though. And I think it's important that we not put the doctors in a position of having one after another sort of pop-up. But it does allow us to present information that is really important, that doesn't require a lot of work figuring out if it's accurate. So I think that's one thing. There's another area I think that we have done just a huge amount of work on. And we've proven to the physicians where our model is really much like a private practice, keeping its identity. It isn't that we manage every part of their practice. So some of these things are elective, like do you want to have this or that? We provide, I think they're called Privia Plus services. And so you can have, again, it's a non-physical scribe, that is integrated into your office so that the information from that visit can be collected. And all of that work of putting things in the electronic medical record is done by somebody else. And then, of course, reviewed by the physician. So that's called Scribe Plus. There are also things like Coder Plus and Biller Plus. And as a gastroenterologist, I can tell you that the vast majority of my career, I had no idea if I was billing correctly, if I was getting paid correctly by the payers. And these tools allow us both to give the physician a kind of an assist on doing appropriate documentation and coding, as well as making sure that they're billing appropriately so that the payer is not going to say, oh, well, you put the wrong stuff down for that. You're not going to get it. Kind of helps them negotiate that. And the technology in the background, I think we've won an award called the HFMA Award for Revenue Cycle, that basic fee-for-service stuff that ensures that the physician is being paid appropriately. And if they're not, it takes action without bothering the doctor or the practice right away to go see if they can collect that money. So those are the kind of things that enable a practice actually to do better, appropriately better financially. and take a lot of that burden that is so frustrating to practice.
Yeah, I can see where that would free up time for doctors to maintain a primary focus on the patient, which they are so great at and will produce better outcomes all along the way, as well as strengthen the relationship between the patient and the physician. If the physician can be less rushed, more in tune, and so great work. How would you say Privia Care is changing healthcare as we've previously known it?
Yeah, I think that all of us are trying to transform healthcare, right? I think that's what your company does, I'm sure, and most others are trying to do something different to improve outcomes. So I think what we do different is improve outcomes. We have a very high engagement rate with our practices and with our patients, I think. And in value-based care, for financial success in value-based care, you got to improve the patient. It's not like disconnected. I'm gonna do my usual business and get more money for it. It actually relies on improved outcomes. And in the United States, we have kind of a disappointing record in improving outcomes. In our ACOs, we have, ACOs in very different markets, right? In Houston, Texas, a very intense hospital market. In some areas in Georgia, we have rural practices, nowhere near a big city, as well as ones in a big city. So very, very different types of models. And I think if you look across the board, we generally are very successful with our accountable care type contracts across Medicare and commercial contracts, because we have certain things like fewer hospitalizations, fewer ED visits, right? We have in most markets better rates where the diabetics are well controlled. So there are outcomes like that that I think allow, first of all, shared revenue with the payer and with the government.
Mhm.
That brings the physician a little more revenue, I think, outside of the mainstream fee for service, and that just enhances the practice. It certainly, makes the physician and the practice feel better. It makes it possible for them to hire people so that they can do the job of taking care of these patients better. And it takes a little bit of that, I think, burnout, takes a little bit of the edge off of the burnout. Most doctors, I find, are just workaholics. And so if you bring them, something really good, many of them just work harder anyway, right? They don't allow it to relax. But some of the things that we bring them do allow them to say, wait a minute, I don't have to do this. I don't have to race from patient to patient. And I think that's so important to that outcome, having a relationship with someone who really cares about you, and you actually have confidence that they care about you, that they're going to watch out for you. So I think that we have better outcomes, and that's generally where we want to be. I think great care for patients. Physicians want to join us because we're not talking about the technology in the first place. We're talking about first, let's take care of those patients. And then here are the ways that we can do that and help you do that. So
Yeah, it's truly a win-win when the physicians become more satisfied and the patients become better, and the timing couldn't be more appropriate than on the tail end of this pandemic and the shortages in staff everywhere.
yeah.
So what is next for Privia Health?
Well, I think if you look us up, you'll find on one of the websites it says we're here to transform healthcare. And that's what we want to do. We want to transform healthcare. I'm old. I've been trying to transform healthcare for a long time. So I'm not thinking that I necessarily will see it all change in my lifetime. But I certainly want to participate, and our physicians want to participate in that too. They want to see things get better. So for that, what do we need to do? We need to continue to grow. And that's what we plan to do, is to grow so that if we have a model that we can say is successful pretty much everywhere, taking better care of patients, reducing the total cost of care, I think then you begin to think, well, can we really transform healthcare? And I think many others think, hospitals are obviously critically important, but hospitals also know it's better to have a patient home and healthy. They believe in it, right? And so I think that with our activity with hospital systems, I think that's going to grow significantly and allow them to concentrate on managing the hospital and their physicians in the hospitals, as well as they can be managed, and then allowing those community providers to grow around them, I think is really important. So we have to continue to grow. For us to grow, we have to continue to provide great service to our physicians. We have a very low kind of dropout rate of our physicians. It's critical that we keep that because I think it just is another example of how we are actually doing what we say we're going to do. So we need to grow and we need to be successful, right? We need to really be very valuable in the value-based care area, bring extra revenue to the physicians that way by improving outcomes. And so I think, in the simplest of terms, I think it's great care for patients by enabling physicians to provide great care, helping them do that, and then growing and being successful or winning.
Yeah. I saw on the website where you already have incorporated OBGYN specialty, pediatric specialty, trying to remember all of them. But is there any particular targeted specialty that you guys are looking at for integration next?
Yeah, we have. In fact, before this, I was working on a discussion that I'm going to have with a group of specialists in Privia. We have something called the Specialty Collaboratives.
Mm-hmm.
You mentioned pediatrics, OBGYN, we have ENT, pain management, surgery. We have a whole series of them. We're integrating them thoughtfully into the groups that we have, because in value-based care, of course, you need specialists to be tightly integrated. We're bringing specialists into the group. We're also connecting them with e-consultations inside the group. That's not a baked pie yet, but we have begun that process with pilots in all of our markets now, where specialists are basically, at the point of care with the doctor and say, I need help with this patient. It's not 2 hours from now or tomorrow.
Yeah.
It's within 3 minutes.
Wow.
Right?
Yes.
I mean, just think it's a lot like the old days a little bit. You can share more information, but in the old days, I used to call Dr. Smith, the general surgeon, and say, "Hey, I've got this patient here. What do I do?"
Yeah.
And they would say, "Well, do this," or they'd say, "Send them over," or whatever. I think that the specialties are going to be very important to us. The group that I came from in Houston actually was an OB group. I was not OB. I'm a gastroenterologist, but I had worked at Memorial Hermann,
Mm-hmm.
and they thought, well, I know a lot about this stuff, and we can help them grow a primary care group around them.
Mm-hmm.
So our platform actually is modifiable to really support specialties, and I think you'll see us growing in that area in the future, as well as with our typical, medical group growth and hospital growth. There probably will be specialty verticals. In the meantime, we want to integrate the specialists that we have into our value-based care programs. I think for specialists, there's not a lot in that space. Even the ones that have been somewhat successful that you hear about around hip replacement and knee replacement are not uniformly successful. And when you look at the whole package, they generally haven't saved a lot of money when you look at the other expenditures that occur. So we're looking for ways to actually find ways to build value around the specialties. And I think, the truth is, I'll give this plug to specialists, and I'm a little biased because I'm a gastroenterologist, but a primary care doctor may not know as much about certain complicated heart conditions or intestinal conditions. And wouldn't it be great if we really did work together?
Yes.
That we're in the same platform. We can see what happened. We can ensure, if I'm a gastroenterologist, I can say, Mrs. Smith, you haven't seen Dr. Jones about your diabetes lately. I'm going to go ahead and put a note in here, and I want you to go see him. I'll send him a referral. So it's actually something that the doctor goes, okay, we'll do something about that. At any rate, so I think that's an important part of what we're beginning to build.
Yeah, I can't help but think how beneficial that is to patients as well. Even from a standpoint of building the perception that their care is coordinated, as opposed to fragmented, just puts them in a different frame of mind to know that they're being cared for holistically, and not a body part or a particular disease, but a whole person being looked at by all of the different specialties that will keep them with their best health. So that sounds absolutely wonderful. Thank you so much for spending time with me today, and telling our audience about Privia Health. I wish you and Privia Health all the success in the world going forward. And if there's any last words you want to share with the audience, please feel free to do that now.
No, I appreciate helping us get the word out about Privia, and I think that our success is going to depend on people actually hearing about us and believing it.
Yeah. Well, thank you, Dr. Fernandez, and thank you all for joining us. I hope you'll join us again soon for our next episode of Bringing Virtual Care Home.